Canadians should be getting their first shot sooner than expected, at least some of us. The primetime panel is back. Laura Stone, Zane Velji, and our guest epidemiologist and associate professor at the University of Ottawa, Raywat Deonandan. Professor Deonandan, I'm going to start with you. Johnson & Johnson approved today. What do you think this means for Canada's overall vaccine rollout?
It could be a game changer.
Yeah.
It's only one shot, and we store it at room temperature for several months. So you could see it being deployed by family doctors, by pharmacists, even in hospitals to inpatients with one or more comorbidities who currently aren't on a priority list. And for people who don't show up for their second dose, which is a common thing in the USA, believe it or not, this takes that problem away. So it allows us to reach herd immunity a bit faster. Also, it looks to be more effective against some variants, especially the so-called South African variant B.1.351, more so than AstraZeneca. And it was tested in a time when the variants were circulating. So it's a bit more compelling in that sense. And it's one more tool on the table, which is always a good thing.
Yeah, for sure. And all of this coming, so we have the J&J approvals, we have the moving up of the Pfizer doses, but I think something else that's obviously having a really big impact is the decision by provinces, thanks to those guidelines from NACI, to space out the doses, right, to up to 4 months apart. What do you make of that decision, the fact that Canada seems to really be deciding to dig in and go that road?
I think it's defensible. I understand how people are hesitant about it. It seems like they're experimenting on the population without reason. But there is reason, because we're racing the potential dominance of the new variants. If we want to avoid the new variants from being dominant sooner, if we want to avoid the likely third wave, or at least the toll of the likely third wave, we have to get a maximum number of doses into a maximum number of people. That means probably extending the time in between doses. This problem could be solved if we had more doses to give, but we don't. So this is the best way to use the doses that we have. Vaccination is not about making a handful of people hyperimmune. It's about making a large number of people in the population adequately immune, and this allows us to do that.
I just want to touch on one more thing that you said at the beginning there about how you understand that people could see this as an experiment. Dr. Mona Nemer actually said on this program that that's how she views it, and I wonder what you think of such a high-profile scientist assessing this decision that way. Was it fair of her to characterize it like that, do you think?
It's not incorrect, but we have to remember that public health is not like other sciences. It's not based strictly and hardly on the best quality evidence. It's not evidence-based medicine. Public health is making do with what you have. Our mask mandates, our lockdown mandates were not based on the best evidence either, but time was pressing and the need was dire, just as it is now. So we have to weigh what the potential risks and rewards are. We're weighing the potential rise of new variants and a third wave versus maybe waning immunity in several months' time. And that strikes me as a fair assessment and an arguable set of arguments in favor of delay.
Yeah. Laura, you obviously cover Queen's Park. Talk to us a little bit about how Ontario's plans have been shifting.
Well, look, I think Ontario today provided what a lot of people in this province wanted to hear, which were some details, some meat of what they're actually planning to do here in terms of vaccinations. We got a rough timeline that was kind of later changed by the chair of the task force to bumped up a bit. But we're expecting, at least by the end of May, those over 60 will have gotten a shot. And General Hillier even said that, the hope is that everyone, all adults who are eligible will get a shot by June 20th. And that is the goal. So that's clearly significantly faster than the province had been planning for. I think, it was interesting. Journalists got a technical briefing around noon, just as the J&J news was breaking on the federal scene. And even after that, it was sort of stale in terms of the timelines. I think this thing is moving fast and furious. The timelines are going to be bumped up, and people just want to make sure that they understand which groups they belong to, how they're going to get the shot, how they're going to get in line for it, and they want this thing to be over as quickly as possible.
Yeah, that hunger for those appointments, it's a very powerful thing, right? And I think more and more of us are starting to think about it vis-a-vis our own family members now that it's suddenly a reality. It's something obviously that folks have gone through, Zane, in Alberta. I wonder how you think all of this positive news, because it is ultimately a lot of positive news in terms of getting needles into arms sooner. How does it play into people's behavior? Because obviously we are still in the midst of a pandemic right now, and there's a lot of concern about a third wave, and as Raywat Deonandan was saying, variants as well.
Yeah, I think the risk is that people's optimism is an excuse to start demonstrating some of the behaviors that they'll want to demonstrate after they get their shot. So giving up just as we're at the 1 yard line, I think that's a potential risk. There's also potential behavior risk around FOMO, right? We'll see, the fear of missing out on the vaccine, but if certain provinces ease restrictions sooner because they had just better, finishes, so to speak, at the end of this program, then you're going to see certain provinces and certain people get antsy and perhaps demonstrate those aforementioned behaviors even before they get their shots, or feel like, enough people have had it, I'm going to get mine in a couple of weeks. And that's kind of where we can have some of that dicey behavior, so to speak, that the doctor can speak much more, acutely to in terms of what that could cause in terms of ramifications down the road from a health vantage point. But I think that's the main concern. And on the political side, it's provinces competing against each other to finish strong the final mile, so to speak. And you could surely expect that regardless of how well they ran their race, they're going to want to attach themselves to the coattails of the federal government and the great news that is coming now, and finishing strong with their logistics, as we get closer and closer to having more people with the vaccine in this country.
Yeah, the point was made earlier on the program by one of our commentators that man, that ramp up is coming quick. It really is going to test all the provinces. Two-thirds of the supply for the third quarter are going to come in the next month. So those systems are going to be put to the test. And we know that some of them are going to wobble a little bit before hopefully finding their feet. But Professor Deonandan, I do want to ask you about that question of pulling back on restrictions. Obviously, we know, like here in Ottawa, for instance, Dr. Vera Etch is saying this morning, we're probably on the cusp of a third wave right now. So it's certainly not the time to pull back. But I wonder more broadly what your thoughts are for public health officials across Canada as we start seeing the effects of vaccination. When is the right time to give people a little bit more freedom?
Right. Dr. Mike Ryan of WHO said earlier that we don't want to squander the hope that vaccination brings. And we squander that hope by opening up too early and putting us back on the path to hell. And I like to think of this as a movie in 3 acts, an action movie. We're in the third act right now. And in the third act, you fight the biggest foe. And we haven't quite fought that big foe yet. And that foe is going to be the third wave and the new variants. It may be a little foe, but it might make big if we loosen up too quickly. So we have to think about the foe, the enemy in front of us right now, and not look past that. It's deeply concerning. And I do notice people are thinking about their summer plans already, thinking about when they get vaccinated, the dinner plans they're going to have, and they're forgetting that we aren't quite there yet. We have some time to go still. Yeah.
So, in terms of how we, even once we're vaccinated, what should our expectations be like in terms of how much we can change our behavior?
Right. Now, to be honest, 2 vaccinated people who've had both their doses can probably interact with relative freedom. But we're concerned that if you're vaccinated, you probably are able to transmit at least a little bit. We think, we're not sure. So we want to protect the unvaccinated from the vaccinated who are going about their lives and might be able to transmit. So if you've been vaccinated, you probably should wear a mask still. You probably should avoid becoming infected and avoid infecting others until we get sufficient transmission reductions that the overall population is safer. That's how we keep our children safe as well, by the way, because they're not going to get vaccinated anytime soon. So we have to drive population transmission down by strategic vaccination and continuing to use our mitigation tools like distancing and mask wearing, at least for a couple more months, probably a bit longer than that.
Okay, we're going to leave it there. Thank you so much, Professor Raywat Deonandan, for joining us. And as always, a thank you to Laura and Zane. Power and Politics is going to be back right after this short break.